So today I got another post from someone that posted something on Facebook, and this post reads, "A new mRNA vaccine fights pancreatic cancer and could add decades to lifespan." So anytime, new solution to fighting cancer always sounds exciting and promising. So when you kind of read the caption with the post, takes you to a page with, I guess, from Memorial Sloan Kettering. And that title there is "An Early Phase Pancreatic Cancer Clinical Trial, Investigational mRNA Vaccine Induces Sustained Immune Activity in Small Patient Group." So the basic premise is, hey, we're going to try to make a new type of vaccine-based therapy that could stimulate the T cells or immune cells to fight cancer. And so as I looked at that, I remembered that years ago, I met with all these immunologists. And I asked them, hey, why does immunotherapy fail so often? Like, of all the different therapies, immunotherapy fails like 85% of the time. And part of it is it's the ridiculous assumption that everyone needs the same tool, right? So if you just look around, everyone looks differently. The reason why we all look different is we have a whole bunch of genes that differ dramatically. And what you can't see is all the differences in the genes driving our immune system. And what you also can't see is all the chemicals from the environment and all the different microorganisms that influence our immune function. So if we were to reframe this and say, hey, what's the best strategy to help anyone with cancer strengthen their immune system to do a better job at fighting, say, any cancer, not just pancreatic cancer, because the global idea would be to help everyone. You could do something simple like go into any AI program, and I don't want to mention names or anything, so I'm not trying to slam a given program, but you could do something like, say, what nutrients do all immune cells need? And then just approach it from something like that. And it'll tell you like certain things like vitamin C, vitamin D, vitamin A, vitamin E, zinc and iron. Limitation with that approach is it's pulling from what it considers primary sources. So then if you reframe it and you say, okay, do all cells need all nutrients? And it says something like not every cell needs the same nutrient. But there are basic functions like oxygen and water. No mention of that at all. There's certain other nutrients. So for example, if you said something like, do immune cells need EPA? And it says yes. So it didn't tell you about the EPA at the beginning, but if you reframe the question, then it pulls up the EPA. So a more simpler approach would be to say something like this. Every cell in the body needs oxygen, water, vitamins, minerals, essential amino acids, essential fatty acids, and some other nutrients or cofactors so that it can function in an optimal way. Now, not every cell is going to need the same exact amount, and you might, cherry pick and say this cell doesn't need this nutrient, but the main point would be you're not going to know which cells have which nutrients in your body because there's not a single method right now that could test every cell. So we kind of simplify it and say, hey, make sure you have enough of all the nutrients so that now when you're exercising, you have the best chance of stimulating your immune system in a way to fight cancer. And now you're starting way ahead of the curve because most people aren't even told those basic facts. So they're going into a treatment and they're basically several magnitudes below zero. So they're way behind and they're thinking that the single treatment would help them as opposed to positioning things where they could be way ahead and then they may not even need the treatment. So hopefully it's just different perspective to give you some insight on other ways that we could approach problem solving and help people right now that are trying to beat cancer.